Sickle Cell Foundation of Minnesota was born out of a very personal experience, mine. My name is Ray Blaylark, and I'm the founder and executive director of Sickle Cell Foundation of Minnesota. I want to share how and why the foundation came to be, what sickle cell disease is, why it matters, and the incredible work that we do, and how much we need your personal and corporate support to continue to expand our work on behalf of the sickle cell community right here in Minnesota. In 1996, I gave birth to my son, Trayvon. After his birth, newborn screening revealed that he had sickle cell disease. And in that moment, our lives changed forever. What should have been one of the happiest moments of a mother's life, the birth of her first child, was altered by this diagnosis. I was confused and scared. I didn't know anything about sickle cell disease. What would this mean to our family? What did it mean to me? How would Trey be affected by having sickle cell disease? What would his life be like? So my first question was, what exactly is sickle cell disease? I soon learned that sickle cell disease is a genetic condition. It's passed on to a child by two parents who both have the gene for sickle cell trait. And when you have sickle cell disease, the shape of normal red blood cells, cells that look like smooth, puffy donuts with the hole not quite punched out in the middle, they change and become the shape of a sharp, rigid sickle. Now, this genetic mutation actually came about for a good purpose. It helped prevent people from becoming infected and dying of malaria, a devastating disease that to this day infects hundreds of millions of people every year and kills well over 500,000 people annually. Now, over the years, sickle cell disease has been considered a Black person's disease. Why? Because it's most commonly associated with people of African descent. And although Africa carries the greatest burden of this disease, this mutation is also found in people with family ethnicity from Central and South America, the Caribbean, the Middle East, Mediterranean, and Southeast Asia. In fact, there's over 1 million people in India suffering from this disease as well. So what does having these sickled cells do to a person? Normal, round, puffy blood cells have no problem floating through your bloodstream. However, sharp, rigid, oxygen-depleted sickled cells are a different story. They scrape along the sides of the blood vessels and they clump up and cause blockages and blood clots. Having sickle cell disease causes several serious health problems. One of the most well-known symptoms is major attacks of pain, which are known as sickle cell pain crises. Now, when I say pain, it's not like pain that you and I might think of as pain. This isn't I stubbed my toe pain. This isn't I threw out my back pain. And this isn't I broke a couple of ribs pain. People with sickle cell disease describe a pain crisis as feeling like shards of broken glass flowing through their veins, their entire body being squeezed like someone is trying to break every bone they have. It's being pierced like by millions of needles over and over again, all over their body, like they're on fire and being run over by a Mack truck. A sickle cell pain crisis is overwhelming and it's debilitating. But pain is only one of the external signs of what's happening internally. Sickle cell disease also causes anemia, which means that blood cells aren't able to carry enough oxygen. That causes massive chronic fatigue, muscle weakness, exhaustion, headaches, confusion, even passing out. Now combine that with sickle cell pain crises and imagine trying to hold a job, much less carrying out the basic functions of daily living. So whether you're an adult living with this disease or the parent of a child or children who have sickle cell disease, your entire well-being is impacted by this condition. Most serious of all, organ damage, and are prone to serious and sometimes life-threatening bacterial infections. The risk of having a stroke, which can cause paralysis and permanent brain damage, is 3 times higher for this community. It should be of no surprise that as they get older, they often develop significant, ongoing, long-term pain and other complications that ultimately result in an average life expectancy that's 30 years shorter than the average person's. So what about treatments? What about a cure? Well, since sickle cell disease is genetic, for most people, it's a lifelong chronic condition that needs to be managed. And while advancements in healthcare have made major progress in other genetic conditions and diseases, such as cystic fibrosis, there have been very few major improvements for sickle cell patients over the past century. Today, the only curative therapy for sickle cell disease is a bone marrow transplant. But transplants aren't available to everyone, and few people have a suitable match because of a lack of diversity in bone marrow registries. Gene therapy trials are showing promise, but it will be some time before these treatments are proven safe, effective, and widely available. It took 88 years before we had a drug called hydroxyurea, the first medication available to treat sickle cell disease, and even that medication wasn't created for sickle cell disease. So, despite all of the medical progress we hear about, we still have a long way to go. So back to Trey. After he was diagnosed with sickle cell disease, we were plunged into the healthcare system. A lot of the time we had great care from specific doctors, nurses, and specialists, but we also had what I would call mediocre care. Sadly, there were also times that we had almost indescribably horrible care. One time in an emergency room where I had taken Trey when he was in a severe pain crisis, while he was still writhing in pain, waiting to get pain medications, a nurse turned to me and asked, "So did you give this disease to him or did his father?" What quickly came into sharp focus was the inequity in the American healthcare system and the lack of accountability for individuals and systems that continue to perpetuate this inequality. An interesting comparison is cystic fibrosis. Both cystic fibrosis and sickle cell disease are inherited genetic conditions that cause intermittent hospitalizations, complications, and ultimately a greatly reduced lifespan. Pretty similar, right? Well, although sickle cell disease affects 3 times as many as cystic fibrosis, CF receives over 11 times more federal funding. Now, here in Minnesota, it became obvious that there were almost no resources for patients and families, not to mention the tremendous lack of an informed community to embrace and support them. Now, outside of a particularly caring or involved doctor, nurse, or maybe a social worker, we were left to fend for ourselves. To give you a stark example, although in 2009, the CDC estimated that there are up to 120,000 individuals living with sickle cell disease right now in the US, we still do not know the definitive number of patients who have sickle cell disease in the state of Minnesota. Think about that. Today, right now, no one can tell you with certainty the number of patients living with sickle cell disease in Minnesota. Patients, their families, their caregivers have fallen through the cracks of this system. And we live in a state with some of the best healthcare in the nation for most people, but not for all people. I had to try and make a difference, not just for my own family, but for all of the other families wrestling with sickle cell disease right here in Minnesota. And in 2015, I started Sickle Cell Foundation of Minnesota. Our mission is to improve the quality of life for individuals and communities affected by sickle cell disease and sickle cell trait. We do that by providing programs and resources to meet the needs of individuals, families, and healthcare professionals in the sickle cell community. We provide ongoing education to patients, families, caregivers, and medical providers through our Sickle Smart Education Initiative. In 2022, we launched Sickle Smile, our community behavioral health and wellness program. We also assist with concrete needs and provide critical support to help patients and families navigate the social and financial burdens associated with having a serious chronic condition like sickle cell. Many of these patients and families don't have the resources to afford some of the basic medications or even get themselves to vital follow-up appointments. So the foundation provides a variety of patient assistance programs to address the needs that often get in the way of their ability to maintain and maximize their health. Our advocacy and action programs provide ways to incorporate the voices and lived experiences of those living with the burdens of this disease. We help to provide a voice to the voiceless and to make sure we have representation when and where critical decisions are being made so that we can impact the trajectory and outcomes for thousands of people right here in Minnesota. We're incredibly proud that Sickle Cell Foundation of Minnesota does a lot, but we do it with very little. But there's so much more to do, and so much more that we could be doing, and so much more that we need to be doing. These patients, their families, and this community deserves more. Over the past few years, we've heard a lot about the concept of equity, about righting former wrongs, about focusing on communities that have historically been forgotten or ignored. That's great, and it's long overdue. But what we don't hear enough of is how and what we can do today to help the people and communities who have historically been seen or treated as less than by organizations and institutions. Donating to Sickle Cell Foundation of Minnesota is a way that you can step up today and help create a more equitable world for people who have all too often been left out. Please help us continue and expand the important work that we do every day right here in Minnesota. To help the entire community of people impacted by sickle cell disease, we need your support. And we know you can do it. We thank you in advance.